All right, it is the start of the hour. I am Dr. Joanne Yanez. I'm the Executive Director for the Association of Accredited Naturopathic Medical Colleges, and I welcome you today to our webinar on postpartum depression, helping moms with a natural approach. We have with us today Dr. Angela Potter. And before we begin, Dr. Potter, if you can just go to the next slide, please. Just a little bit of housekeeping. So you are all in listen only mode. If you do have any questions throughout the course of the webinar, please use the Q&A box. Hi from the UK, welcome. For any questions during the course of the webinar, please use the Q&A box. We will be recording this and we will send out the recording when it is ready. If you have any difficulties during the course of this, or if you have any questions afterwards, please feel free as always to email us at info@aanmc.org. And with that, I'm going to introduce our speaker, Dr. Potter. Dr. Angela Potter is a leading holistic doctor supporting moms in their healing process after birth. After the birth of her first baby, she came face to face with the hardships many moms frequently experience after birth. She's since then developed Postpartum Wellness Protocol that she uses with mothers nationally. She's been interviewed for Healthline, for postpartum specific articles, and is a nutritionist as well as a doctor. Her office is in Portland, Oregon, where she lives with her husband and two toddlers. You can find out more about Dr. Potter at her website, and we'll have all of the contact links afterwards. So with that, Dr. Potter, welcome. And I'm going to make my face go away. I'll still be here.
Thank you, Dr. Yanez. Have you ever been awake at 3 a.m. with your baby screaming and you start thinking, should I be a mother? Have you ever felt that pressure because you're the mom that you should know everything and do everything, but inside you're saying, wait, everyone is looking to me for help, but I need help too? You're not alone. Imagine if you felt honored in this time after giving birth for all that you're doing and all that you have done during birth and pregnancy. Imagine if you had balanced moods so you weren't yelling at your kids for the small things and you weren't resentful towards your partner. What would that be like for you? How would that feel for you? I know what it's like to feel confused and unhappy with motherhood. When I had my first baby, my son, I didn't plan for anything postpartum. I didn't think that it would be a difficult process. And I figured that my husband and I and our new baby boy would just have this idyllic time together and it would be wonderful. And then I had my boy, gave birth to him, and a couple of things happened in that birth which really set me up for very difficult healing. Him and I had to be separated for just about 2 hours after birth, but that was incredibly emotionally hard for me. And I had a second-degree tear, which for my body at that time was made a lot of pain for me, unfortunately. And I remember this one moment very clearly that, I was about 8 weeks postpartum, so much further after birth than I ever expected to be feeling this way. But I was, it was about 8 weeks. I was in bed because I was still in a lot of pain. I couldn't walk up and down stairs. So I was upstairs in the bedroom. And my husband comes into the room and he picks up our baby boy and they have this really beautiful moment together. And I'm watching them. And of course, it's a wonderful to be watching them together. But then also I was having all these thoughts go through my mind like, wow, this feels confusing. I'm the mother. I recently went through birth and yet I can't focus on these sweet snuggles with my baby. I am wondering, am I alone in this? Is my body doing something wrong? And why does this feel so terrible, honestly? And it was in that moment when I knew that there was no way that this is how postpartum healing was supposed to be. And I knew that there had to be answers. And so I committed to myself to first heal my own body because I was 8 weeks postpartum and I needed to focus on that. And I also knew that it was my journey as a doctor to be supporting mothers who were feeling like I was feeling. And so, I moving forward from that moment, yes, I did. I got to a place, it was probably about a year postpartum where I was finally feeling strong and balanced and healthy. And then moving forward from there, I got pregnant with my second baby. And during her pregnancy, I just was dedicated to putting together a postpartum healing plan where I would have the support and resources that I wished I had after the birth of my first. And I put that together, and then she was born, and I put together this plan for myself, or I started the plan. And it was amazing how much better I felt, how grounded I felt, how balanced I felt, how much stronger my body felt at such an earlier time. And that was powerful. And since then, I have transitioned my practice. So I exclusively work with moms. And through this process, I've developed my postpartum wellness plan that I work with mothers nationally. Let's see. So today, you are going to learn why moms aren't getting the care that they deserve, natural solutions for postpartum depression, anxiety, stress, and overwhelm, and key steps in my postpartum wellness protocol to help moms feel strong, balanced, and healthy. So, you might be wondering, why do moms need to seek out postpartum care? Shouldn't they just go and see their OB? And this brings up a very important point because culturally, we have lost the art of honoring the postpartum time. And what that looks like is that because as a culture, we don't understand the needs of mothers in their healing process, then OBs and many midwives, not all midwives, but many, are only taught about how to support a mother during pregnancy. And then, of course, through the birth and emergency postpartum care right there in that first day or two postpartum. Now, that information, of course, is extremely important, and we actually even need more of it. So I'm not here to say that we need to take time and resources away from that. No, of course not. But for OBs and many midwives, that's the end of their training, right? And they aren't trained in how to support a mother in this ongoing process as she moves away from birth, what kind of foods she needs, what kind of hormone balance support, what kind of nutrients she needs in this time. And so that brings us to a place where mothers are getting their 6 week checkup and being told, oh, you look fine, sex and exercise, you're good to go, in a 15-minute appointment. And for so many mothers, they don't feel fine at that 6 week mark. And then they're confused because they're still not feeling fine, but their practitioner told them, oh, well, you look great and good luck. And yet they're left feeling struggling with mood swings, depression, anxiety, and balancing it all on their own. And this is a huge disservice to mothers. The shortfall for mothers is twofold. So first is that they only get the 6 week visit postpartum. And that 15-minute appointment I was just describing. But it's common for moms not to feel fine at that time. In fact, that's a huge postpartum myth, is that the healing takes place within the first 6 weeks. And because we don't have the care for mothers, then mothers are left with health issues far longer than that. Moms come into my office, could be really soon postpartum, but frequently it's at 10 months, 12 months, 3 years postpartum. So the other shortfall for moms is that they're told that antidepressants are the only answer. Now, here's the thing. Sometimes antidepressants are helpful and they're an important part of the postpartum healing journey for many women. But the issue is that they're being used as a blanket treatment for anything that comes up for women postpartum, right? I hear stories of moms who come in and say, I went to my practitioner to talk about the pelvic pain that I'm having, and I left with a prescription for an antidepressant, right? Like that's not an appropriate time to be prescribing antidepressants. And again, that shows this incredible misunderstanding that the medical community has for the needs of mothers. And what's missing from postpartum care are practitioners who are walking alongside mothers, providing them with a nourishing food plan that is specific to their healing after birth. What's missing is a replenishing postpartum health plan that focuses on providing their bodies with the proper nutrients, blood building, hormone balancing, while the mothers are in this depleted state to get them to a place where they're replenished and that where they can feel strong and healthy. And what's the cost of not resolving this lack of care for mothers? So we now have mothers who are required to balance so many different things and are saying things like, I'm sleep deprived and exhausted. I've never felt this way. Is my body doing something wrong? And they're struggling to take care of their families, let alone be productive at work, right? And then there's resentment towards their partner and exhaustion to even get through the day. This is a time that's supposed to be magical and beautiful for these mothers and their families, and yet they're left managing it mainly all on their own, struggling to heal their bodies, taking care of their baby while waking up multiple times a night, going through the day sleep deprived, needing to cook food and then start going back to work on top of that. No wonder 1 in 7 women has postpartum depression. But there is hope. The hope is that there are these wonderful, natural, and effective therapies to help women gain footing and find their health again and feel like themselves again. And what we need to do is support mothers with a nourishing food plan. And I'm going to talk about nutrition here today. And we need to help mothers balance hormones to help balance stress and irritability, which we're going to get into. We need to look at deficiencies that are common in this time that are leading to the irritability, the depression, the anxiety. And this is what I work with my patients who are going through the postpartum wellness protocol. And I'll tell you a quick story about one of my patients. So she came in to see me at 8 months postpartum, and she came in, she was having anxiety and incontinence. She was working, she was self-employed, but she was having to take all of these days off of work because she was exhausted and struggling with anxiety and that, balance of work and motherhood. And that was really frustrating to her, of course. And so we did some simple lab tests for her. She had not gotten any follow-up done since her baby was born. Turns out she was having postpartum thyroiditis, which affects between 5 and 10% of women within the first year after giving birth. And we got her on a nourishing tea that is hormone balancing. We got her on natural supplements that are calming and grounding. And even at that next appointment, 1 month later, she was feeling so much better. She was able to verbalize her needs more. Her husband and her were able to communicate more so she didn't feel resentful towards him. She was getting more sleep, and she got to this place where she was looking forward to her days, saying, this is a fun adventure. What will we do today? Instead of, Lord, when will I eat and when will I sleep? And that continued for her, right? We got her thyroid normalized. All of her thyroid labs are now normal, and we're working on helping her body prepare for her next pregnancy. So exhaustion. I am sleep deprived and exhausted. I've never felt this way. Is my body doing something wrong? But imagine if you could say, getting through the day is a lot easier now. Now that I am in tune with my body, everyone in the house sees these benefits and I can show up more for my baby. I mean, exhaustion is almost universal for mothers. And, of course, it comes from the sleep deprivation that is usually, from day one of being a new mother. But, then there's this other element of needing to balance everything and manage maybe, older kids or work or just getting through the day. And so, the most important thing to help improve energy throughout the day is to look at nutrition. And this is step number 4 in my postpartum wellness protocol. So, what does nourishing nutrition mean to a new mom? It doesn't mean restrictive diets, it doesn't mean taking foods away, and it doesn't mean calorie counting. Many moms come in to see me when they're already doing something like this because, again, culturally, we don't have the guidance for moms to tell them what to do. If you go into a local bookstore, right, and you go to the pregnancy section, you will find so many books about pregnancy and nutrition, right? You will find maybe 3 books about postpartum nutrition, which is that expression of our community, our culture not providing mothers with that information. And so, as mothers who are then, past that 6-week mark or maybe earlier, just think, okay, well, how was I feeding myself pre-pregnancy to help me get more energy and to lose weight? And so I'm going to do that, which, oftentimes looks like low calorie or taking certain foods out of the diet. Well, for mothers, that is actually more stressful and can put more stress on the body, which will then not help with weight loss, can actually cause weight gain, and then just leading to more stress, depression, and exhaustion. So, what needs to happen? Focusing on foods that support healing. Broths are wonderful for women, even if they are months to years postpartum. And, I was mentioning earlier how we think that so often it's just the first 6 weeks postpartum when the healing process happens. But because we don't have the care and support within that 6 weeks to help women get to the point where they feel strong and healthy, then women are struggling for years afterwards. And so it's okay to say at 3 years postpartum, like, yes, I have a 3-year old, I have a toddler, and I am still not feeling good. And what you need to do is to take those steps back to say, what does my body need since giving birth? And so what that looks like around nutrition and bringing in broths is, you can make a vegetable broth, which, with carrots and onions, and it's incredibly mineral rich, right? Important minerals to replenish your body. Bone broth is amazing for new mothers because it has collagen in it. And you might be familiar with the hormone relaxin. Many pregnant moms talk about relaxin, right? Because that's what's making their joints loose and sometimes make them just in pain a little bit. And that's what's helping the body prepare for the baby to come. And relaxin stays in the body for months after birth as well, but also in that postpartum healing time, right? The joints and the ligaments, they're trying to tighten up, right? Organs, the uterus, and organs in the abdomen, right, are trying to get back into their normal place and position. And collagen is what is supporting our bodies to do that. And so that is an incredible source of nourishment for mothers. Now, another nutrition tip to help balance energy is to balance blood sugar, right? A mom who is busy and stressed out is usually just eating bits off of her kids' plates for lunch, or, opening the fridge and having a handful of something and then going about her day. And if she's breastfeeding, maybe back at work and balancing all of these things, she might not be able to eat full meals. Well, what are the, s- so if she's doing that and not able to eat full meals or eat regularly throughout the day, what's happening? She is having big sugar swings. And what are the symptoms of blood sugar swings? Irritability, weepiness, depression, exhaustion. That, if you think of that hangry feeling, right? Which for a lot of us, we can just laugh about that because we know it comes, every so often. But for mothers, right, who are sleep deprived and are struggling with that every single day, that is the foundation of feeding a mother to get her to a place where she has energy during the day. So the easiest way to do that is to start eating regularly throughout the day. I talk to my patients about, grabbing your phone and putting alarms on your phone to start getting to eat on a regular schedule throughout the day, and making sure you have got snacks like in your purse, in your diaper bag, upstairs, downstairs, and all these different places where you might be, so that you have access to these calories, these nutritious calories, and to be eating regularly throughout the day. That is powerful to help a mom feel balanced and feel energized and strong to manage all of these different things that she's juggling throughout the day. I am in that cycle of not feeling well. I have to take days off. I can't work as long during the day. I am sleep deprived and exhausted, which is decreasing my productivity. But imagine if you could get to a place where you say, I've gotten myself back so I can enjoy the time with my baby and family, not be a nervous wreck. I can work more. I have greater capacity. So, stress is common for mothers, and I included going back to work as well in here. Moms who are at home have an incredible amount of stress as well. This is not to say that moms who are going back to work are the ones who are stressed out, and moms who are at home, they have this great time taking naps and sleeping with their babies. Not at all. That is also a myth of motherhood that moms struggle with, because people who are around them often, might be even their partner or family members or friends, think that if they're at home during the day, then they must be fine because they have all this time to cook food and take naps if they feel like it. But for the mother who's going through that, often she feels incredibly stressed by just trying to manage the basic needs of the day. So, moms in general struggle with stress. Moms who then are going back to work, that's an added stress on top of an already huge amount of stress. So here's the thing, right? If you're a mother who has not been sleeping through the night in months, who is trying to balance things in your day, whether or not you're going back to work, right? You have to see what your stress hormone cortisol is doing throughout the day. Particularly, right, when you're feeling that you're getting really irritable, having lots of mood swings because you're so stressed, how you can't relax during the day because that stress is so high and just overwhelming you, right? And so our stress hormone cortisol has this wonderful rhythm during the day, right? It rises in the morning. When we wake up, it's basically the hormone that wakes us up. And then it has a slow decline as we move throughout the day, and then a pretty sharp decline in the evening before going to bed, because cortisol drops in order to let melatonin rise and help us go to sleep. Now, That is a normal cortisol rhythm. But because of added stressors to our lives, or, how our bodies are responding to stress, that can look very different for different people, right? I see stress cortisol levels that are, elevated all day long. And if your cortisol is elevated at night instead of low, then of course you're struggling to go to sleep, right? Or sometimes cortisol is flatlined throughout the day. And of course you would be feeling sluggish and just can't get the energy to move throughout the day, right? And so we need to see what that cortisol is doing throughout the day. And it's a simple salivary test that you can do at home. And then the results will tell you what your cortisol curve looks like during the day. And that's really powerful because then working with a naturopathic doctor, then you can get it back into balance. Right? They're really wonderful and supportive ways, simple ways to get that cortisol back into balance. And once that cortisol has a normal rhythm for you during the day, then you can feel like you can handle stressors easier. It's not like your days have changed or your schedule has changed, but your body has changed in its ability to handle stress better. And for a mother, oh my goodness, right? I mean, who doesn't want that? I'm in that day to day floundering, frantic doggy paddle feeling. Well, imagine if you could say, I look forward to the days now. It's a fun adventure. And I say, what are we going to do today? Instead of, Lord, when will I sleep and when will I eat? And I want you to know that these quotes here are things that my patients have told me that they're being used with permission, but this is what moms are literally saying, where they are starting from and how difficult it is for them, and a place where they can get to. These are possibilities, absolutely. So let's talk about overwhelm and anxiety. And another important point is that we're talking about different components of postpartum depression, right? The exhaustion, the stress, now the overwhelm and anxiety. Because postpartum depression isn't one, there's no one cause of postpartum depression. There's no one thing, one pill that you can take to suddenly heal postpartum depression. And that's because it's such a bigger issue than that. It's the lack of support, it's the unrealistic expectations for mothers. And so we need to support mothers in a holistic way in their healing, to come to a place where they feel strong and grounded, which is an absolute possibility. But I wanted to let you know that why I've structured the talk in this way. So overwhelm and anxiety, and anxiety is another almost universal feeling for mothers. And it has varying degrees, right? For some, it is debilitating. It is keeping them from spending time with their babies and makes them feel like a terrible mother. For others, it is more just this kind of thought in the back of their head that they know is always there, but they can kind of push it aside. So there's varying degrees. But the single most important thing that you can do to help with overwhelm and anxiety is to work with somebody who knows how to help you honor this time that you're going through, right? To dispel common myths about the postpartum healing time, like how, 6 weeks is the only time, the healing time that you'll go through. Because if you're at 15 months postpartum and still struggling with anxiety and feeling like you can't talk about that, talk about how confusing it feels to be this far postpartum and to still be struggling with anxiety, right? You need somebody who's going to help honor that time. Often anxiety stems from these extreme expectations that we have for mothers. The fact that we expect that, oh, sure, after 6 weeks, like you're fine. Here's baby, and go ahead and get your normal life and your baby, and you'll do great. And of course, there's, pictures in the media and celebrities that look like they've got it all together. And so that all leads up to really strong expectations for women that often feel incredibly unattainable. And that leads to anxiety, that in of itself. And so working with someone who is going to help lower those expectations, not lower, but to shift them for them to be realistic for you and your family. Right? Someone to help order lab tests to look for hormone imbalances that are common for for mothers, basic anemia for mothers, because it's not standard of care right now to get lab tests run in the postpartum time, which is a huge surprise because of the birth process and how many fluids are lost and the amount of stress that that puts on the body. Of course, it's a beautiful, beautiful time, but it's a lot of stress on the body. And there's no standard of care to get lab work to follow up. So, even just basically checking for anemia, because symptoms of anemia are going to be anxiety, right? And it's very common for mothers to be struggling with anemia. And if that is what's causing the anxiety, right, you need somebody who helps to understand that, to help you find, okay, yeah, well, of course you're anxious because you've been struggling with anemia for the past 15 months. And what else can help with overwhelm and anxiety? Well, balancing blood sugar, like we talked about, getting on a nourishing health plan, looking at your stress hormone, cortisol. All of these things are going to be supporting postpartum depression in a holistic way. What I love about naturopathic medicine is that it gave me answers in an incredibly difficult and confusing time for me. I felt alone and unsure of where to turn for answers back when I first had my son, my first baby. I was telling you that story in the beginning. And I was a doctor at that point. I had been in the health field for a decade. I had been a nutritionist before becoming a doctor. And that led to even more confusion because I thought, wow, why was I not prepared for this? Why was I not told that this would be how my body would feel? All how to handle that anxiety that came up. But within that, because I was already a naturopathic doctor, I was able to use the incredible amount of tools that we have in order to piece things together, which is also why I created my postpartum wellness protocol, because it's not something that's taught in schools to practitioners. And now I do a lot of CE presentations to teach other practitioners this approach. And so I was able to research to find, okay, what herbs do mothers need in this time? What sort of physical therapy do moms need? What kind of, stress balancing and lab work do mothers need in this time? And I was able to put that together using all of my knowledge that I got through naturopathic medical school. And that's powerful. And that's what I love working in my practice with my patients, because I'm able to give them all these answers when they're coming into my office feeling like they've lost hope. So, looking forward, if you are a prospective student and you're considering starting a family or having a baby while in school, You will absolutely need to find a practitioner who can help guide your health and wellness during this time. And if you're a mom already and you are thinking about starting naturopathic medical school, you will need to find a practitioner to help you to balance stress and hormones. Naturopathic medical school gives you an incredible gift of knowledge and the ability to work with others and to help them on their healing journeys. But it's also a very stressful time. It's medical school, it's hard work, and it's important to take care of yourself first. Your health is your greatest asset. If you don't have your health, you don't have anything. And you might be thinking, well, gosh, I'm applying for school or I'm starting school. I just don't have enough time to reach out to work with somebody. Actually, you don't have the time to continue struggling with the exhaustion and the anxiety because every day that you're struggling with that is taking away from the important things in your life. And you might think, well, I'm investing in school. I don't have money to invest in working with somebody to help me. But investing in your health is the single most important thing that you can do. If you do not feel alert and energized and able to handle like constant stressors, school is going to be a really big struggle and you will come out of it feeling not very healthy, not very good. And you need to be in a place where you can handle balancing those stressors and moving forward in an energized and alert place where you feel excited about going to school, about learning all these amazing things, and then starting a practice. Because school is the beginning of a huge journey for you, a much bigger journey than you will ever realize when you start school. And it's incredible, right? It's incredible when you're at a place where I am now, 7 years after graduating, and being able to see the change in myself and my practice and my family since starting school. But you absolutely need resources and support for your own health as you move through that.
And Dr. Potter, I would just add that goes for men and women. I think, stress
Yeah,
management, taking care of yourself,
absolutely.
having boundaries, all of that is universal for all students. And I see a lot of this was focused on the mom and the person as a patient, but we also have men on the call who are interested in being providers too and providing the most comprehensive care that they can.
Mhm.
So this is a really great talk. I know a lot of folks are appreciating it. Go ahead.
Wonderful. Thank you, Dr. Yanez. Yes, and for the men here on this call, or if you're not the mother, right, and you're a partner of a mother, you can use these tools to help her, nutrition, of course, is the foundational to helping her feel strong and balanced and to help her honor this time. And because even moving forward, you might think, well, because we have a 1 year old now, she's probably fine. No, it's really important to honor that one, it's hard to manage this and that it's hard to help your body healing in this time. And that, and to just ask, honestly, ask, like, how can I help? So, for you partners out there, those are some tips for you. So, reaching out. If you are a mom yourself here on this call and you are struggling with exhaustion, depression, and mood swings, and you're looking for some answers, then you are going to head to this first link, which is my direct calendar, and you can sign up for a free call with me where we can talk about your most frustrating health issues and then get you on a plan to move forward to feel balanced, strong, and healthy. And then if you're a prospective student and you want to know about more about my postpartum wellness protocol and this approach that I take, then you are going to head to my website. And I have lots of blog posts. I do interviews with other practitioners and lots of information for you there. So you can head to my website and then you can reach out through there as well if you have other questions. I am happy to chat. So thank you so much for being here. I would love to take some questions.
If you can just go to the next slide really
Yeah.
quickly. So before we go to questions, just want to talk about the upcoming events that we have. So Thursday, March 18th from 10 to 2 and 6 to 9 Eastern Time. We'll be hosting the next virtual fair. So this is an online fair that we have for students to attend and talk to students, practitioners, and admissions folks from all the programs. And then in April, our talk is going to be on digestive health and SIBO, small intestine bacterial overgrowth. And so you can go to the next slide. And so here's our contact information. If you have any additional questions after we close today, as we said at the beginning, we will have a recording out for folks to listen to. And we really appreciate y'all coming, and we definitely appreciate Dr. Potter. So with that, the first question coming in is from a practitioner who's talking about or wanting to know more about your hormonal panels and when you're testing and what you're testing. What, as you mentioned, oftentimes there aren't standard tests necessarily unless somebody is extremely symptomatic. So,
Mhm.
maybe if you can talk a little bit about that postpartum lab testing protocol and what you're looking for and when and why, that would be
Yes.
lovely.
Yes. So I'm going to talk a little bit about it. And then I want you to also email me because I have some CE presentations that I talk about this for like an hour. So, like there's a lot more involved in this information.
Yes,
Um,
cover what you would
but
do through the entire postpartum in 2 minutes.
Okay, so what I will say are you're going to want to run, basic lab work like CBC, CMP. You want to do a full thyroid panel because, like I mentioned, 5 to 10% of moms are struggling with postpartum thyroiditis, and vitamin D, B12, and then of course doing the salivary cortisol testing and then looking at reproductive hormones. That is really important, but sometimes there's like a timing consideration because of the hormone flux that moms are going through depending on where they are away from birth. So I hope that gives you some like basic information to start with, but then reach out to me because then I can point you in the direction of like direct CE events that I've done, and recordings that you can take that I go into this extensively.
And if you would be able to just put up your email address again
Yes.
and your website, that
Yep.
contact. There you go.
Right there.
Perfect. Thank you.
Yes. Let's see. I see my email is not on here, but you can contact me through the website and it'll get to my email. So yeah.
Perfect. Um, so there's a question that just came in. Is there an educational plan for families? So obviously the mom is part of the picture, but uh, there may be partners or supportive folks to help them get on board for the need for postpartum care.
Yes, absolutely. And so, how I work with that, right, is that the mom is usually coming into my office, and it's fantastic if her partner is able to come in as well. But when she's coming in, and that's typically what we're working on, in the first couple of visits anyway, is what does that support picture look like in the family? What's the family structure? Who's working, what are schedules, and then how to balance that, right? How to make it work for everyone. And a lot of that is talking about the unrealistic expectations that are out there that unfortunately even partners are a part of because we're all led to believe that moms are fine. And so talking about how to to communicate with partners and how to get some more support. And then talking about, yeah, like these big myths of postpartum healing and realities of what to expect. So, as far as, yeah, any like educational platforms, I don't know where to direct you, but I hope just saying that is helpful enough. And this is one of the most common questions that I get after I give talks. And so it's like, you might see a book come out from me soon because yes, I understand that that's a need. Like the family wants to be supportive and they sometimes just don't know how, and they lovingly want to. And so yeah, so watch for that.
Thank you. What would be the one thing that you would say uh, to someone considering postpartum care? I know that you talked a lot about it, but what do you see as the key benefits for incorporating this and normalizing the need for postpartum care?
Oh, the key benefits, my goodness, are mothers feeling strong and not being overwhelmed and struggling with this constant daily guilt and shame that's sitting on their shoulders because they're not at a place where, they feel great and they're able to shower every day. Again, even if they're, a year or 2 years postpartum. And so just that ability to take away that guilt and shame and supporting them on a plan to get them to a place where they feel good, where they do, feel at that place where they want to be, whatever it looks like to them for their optimal mothering. And supporting the mother is not just supporting that one person. It's supporting her in her relationships around her. It's supporting her as a mother to her children. And I truly believe that the work that you do with mothers is supporting the next 70 generations to come. Because if you can break that cycle of depression, anxiety, shame, and guilt in the mother when she has a young baby, you are supporting healthy and strong generations for futures to come.
Thank you. So there's a question uh, in regards to the return of menses
Mhm.
and what would be considered ideal or normal, and what, because there are different, especially I know that, if you're breastfeeding, there are differences in the hormonal patterns there. But maybe if you can talk to more specifically, not just the return of menses, but how do you know when that mom is feeling strong and good and things are back where they should be? I think we've had, like you talked about, so many false perceptions and uh, you know tough it out, and it's really not that bad, and yeah, you got to do everything and be superwoman and cook and clean and go back to work and nurse and pump and so how do you know when you've been successful with one of your patients?
Yes. Okay. So, first component of that question, as regards to menses, I mean, you would want the menses to be regular, to not be heavy bleeding, and to for PMS to be really low. Now, it's very common for mothers once they're starting to get their periods back for them to be irregular, to have significantly heavy bleeding, or for PMS to be strong, and particularly around that like irritability piece, and which can be confusing because it can be different than what that person's period looked like pre-pregnancy. And so that can be really difficult for them as the patient to be like, oh my gosh, here I am. And I thought I was through. And then now here I am and my period's a mess. And so, yeah, it's important to, at that point, you absolutely want to be ordering hormone labs and helping with cycle changes and stress levels as well. I would say those are going to be the two first things to support a normal menses. Of course, that's like a whole avenue in of itself. So I hope that answers that question. And then, yes, this question of how do you know that the mother is at this point of feeling balanced and strong? Honestly, that's going to look different for every patient, right? Like, what are her goals and how does she want to feel? Because depression is so common, anxiety, mood swings. It could also be physical issues, right? A lot of pelvic pain, incontinence. So, where does she want to be in her body and her mind? And, is it also moving forward in the future? Does she want to have more babies, right? Do we want to get to a place where she feels so strong in her health that she's ready to have another baby and that she knows she has the resources moving forward to have a healthy postpartum time? But, from a basic level, right, you want stress to not be at the forefront, right? You want anxiety to go away, that depression to have alleviated, and for her body to feel really strong. But again, like what exactly that looks like is going to be different for each person.
I'm wondering if you can touch a little bit on something, the mental emotional component. There are some women where the the actual act of giving birth is traumatic for them, or they feel that they had been violated,
Mhm.
and then other women who where maybe the act of giving birth triggers past traumas.
Mhm.
And so I'm wondering if you can talk maybe a little bit about the mental emotional component and trauma resolution for women who either have seen the birth process as traumatic and or uh, reviving old traumas.
Yes, I'm so glad that you brought that up because that's the first thing that I'm talking about with these mothers that come into my office. And that's okay, what was your birth journey? Because if trauma happened during that birth, which is quite common, unfortunately, and the thing with a traumatic birth is it can look incredibly different, right? For some women, it could be that they were, getting wheeled into the hospital and all of a sudden like the bright lights on them that can feel traumatic, or somebody said something while that mother was like in the pushing phase of birth, which is a very kind of vulnerable spot for her emotionally. And if she heard something that could be traumatic. It could be traumatic, where she had postpartum hemorrhage or something like that. So just to say, like, a traumatic birth could look of like a variety of different things, right? But that trauma then sits in the body. And so if that doesn't get addressed, then yes, of course, years after birth, you're going to still hold that anxiety because that trauma hasn't been released. So that's the first thing that I am talking about with moms is what is your birth story? What happened? Which is typically a very emotional time for women to tell this story, and not for all. Some love telling it, but it's not particularly traumatic. And so that act of talking through it is so important. And as the listener, because any one of us who know a mother can ask her what her birth story was and listen with a very supportive ear, and then also just to help her, to kind of normalize what happened, or not even normalize, but say, like, validate that that was an incredibly difficult time for her, and that's powerful. I recommend to mothers to write down their birth story and then read it to their babies or their toddlers, because it's not just you as the mother, your birth story, it's your your baby's birth story as well. And that can be very therapeutic as well. I use homeopathy to get that trauma away as well. That's going to be first line for me. And then I do holistic pelvic floor therapy in my office. I was trained by Tammy Kent, and that can be very supportive for releasing trauma as well. But if you just know a mother, offering to listen to her birth story, or encouraging her to write her birth story down, that's like the first line, a really wonderful way to start that process of releasing the trauma.
Thank you. I really appreciate this. And, I think there's a myth with postpartum depression where like it's just in that short phase after delivery. Uh,
Yeah.
have you seen it progress longer?
Yes, as far as the healing process, yeah, absolutely. And that's exactly it, is because we don't have the support and the care in those first 6 weeks postpartum, then women are feeling the effects of birth far longer. And so, moms are coming into my office at 3 years postpartum and saying, "I have not felt right since giving birth, and I haven't been able to find the right resources for me," because of course our conventional medical model is not doesn't say like, "Oh, we have these resources for you." They just aren't there. And throughout history, throughout different cultures in our world today, they have these really beautiful, wonderful practices that focus on basic physiologic needs of the mother in order to get to a place where she feels strong and balanced. And that includes, proper nutrition, healing teas, and body work, steams, all of these beautiful practices. And so that's what I do with the mothers in my practice, right? Is I am bringing them back to this place where they're getting this replenishment for their bodies, this nourishment, so then they can feel strong. Because of course, if we don't give them the resources and support that they need, then yeah, at 3 years postpartum, they're still going to be feeling the effects.
I'm glad you also brought up the cultural component. As a multicultural person myself, I know, and having gone through ND school, there are many different cultural ways of addressing the postpartum period. And I know you touched on this earlier in the United States. Our way of dealing with the postpartum period is go to work. Not exactly nourishing. So, I think that recognizing and honoring that many folks across the world and many cultures across the world have different paths, but there are common threads. There's honoring the mom, there's support, there is teas and steams and things and ceremonies, even in some cultures of burying the placenta, or there are all
Mhm.
different sorts of cultural practices. And so I really appreciate you touching on that. I think sometimes our medical model can be very focused on the Western component of things, and maybe not as embracing, or not as just providing recognition of so many different ways that different cultures often offer for that.
Yes, yes. And here in the US, midwives used to be the prominent birth workers, right? And they were trained in holistic ways for healing. And that really transitioned in our medical model. And so, unfortunately, we don't, again, looking at it from a conventional medical perspective, it's not first line, right, when it needs to be. And because we're seeing these mothers who are struggling with depression far longer, who are struggling with thyroid issues, and just this that shame and the guilt that I talked about. And so it's necessary to bring these holistic practices back
Or
to
just
support
thinking that they have
mothers.
to muscle through it and that it's
Yeah.
normal. That the
Hmm.
anxiety is normal, that oh, this is just part of being pregnant, this is just part of this, I just have to kind of muscle through it. And so I really appreciate your talk. We're just about out of time, and so with that, I'm going to wrap up today's webinar. You have gotten so many comments in the comment section from folks just being really thankful for this talk. This was really excellent, a topic that is so needed, and so on behalf of me and the AANMC, I thank you for coming. We will have this recording for folks who are interested in it later on. And again, thank you, Dr. Potter. I honor you sharing your story and your experience with us today.
Oh, thank you so much, Dr. Yanez. Thank you for having me. And to all of you who are here listening, many blessings to you. Thank you for being here, and may you feel uplifted and encouraged.
Thank you so much. Take care.
Bye.
And thank you all for coming.